all of us. And it is realistic to feel stressed, to feel anxious, to feel overwhelmed when dealing with something that is new and unknown. This isn't just new and unknown. This is also something that is scary. The news that we do hear can cause people to be afraid for themselves, afraid for others. So we're dealing with something that is really quite big and quite impactful. So I say all of that to lead up to what is probably going to sound overly simplistic is I think there's something we can do to work with this. And I hope it's through programs like this, through using new technologies or technologies that are new to us, we're able to address some of that stress we are feeling, address some of the anxieties and worries. So again, I'm thrilled to be here and to be a part of this, and like to say that it is a program like this that I think can be part of the solution for helping us all deal better with that stress. Indu, just to break it down a little bit, I think you were just saying how are some general recommendations, or what are some general recommendations? Things that are gonna sound so basic and so simple, I think are sometimes worth saying. If you're feeling stressed or anxious, do something about it, and do something that is productive. There are lots of ways that we address these feelings, and some of them are simple, and that's great, because the simpler they are, the easier they are for us to do. I think you've talked about this in one of your other talks, but the idea of exercise, of being physically active to deal with stress is always key. Using techniques like meditation, mindfulness, breathing exercises is a great resource. I'm a psychologist, so I'm going to always say it's good to talk to someone, whether it's someone who's a mental health professional or a trusted friend or family member, or someone who's part of a virtual support group or an organization that shares similar reasons for being there. I think it's great to have those conversations, to be able to talk about what you are dealing with, to talk about how you are feeling, and to do so in the most productive way and most appropriate way possible for you, the individual. We all handle stress differently. We all have different kind of threshold levels for how much we can take and how much we can deal with. And so to be aware of your own and how much you can deal with, and to really especially try to be aware if you feel like you're getting pushed over that edge, because that might change the type of person that you would want to talk to, right? Kind of your general run-of-the-mill stress, right? Like, man, did not sleep well last night, and the stuff that's on my list to do this morning is really, feeling really overwhelming. Sometimes talking to your partner, your spouse, your kids, your best friend, that's going to be helpful. But if you're dealing with something that's a little bit different, say it's something that you've never felt before, like, oh man, I'm, feeling anxious and my whole body is feeling like this. And, I feel like my heart's racing all the time. And I wonder if I'm having a panic attack. If you're having any of those thoughts, that's a good opportunity to say, maybe I need to talk to someone else who's got some specific training. Talk to a counselor, talk to your medical doctor, talk to someone in a support group network, because sometimes those are places that you can address those things. So being aware of yourself and being aware of whether this is something you've dealt with before and kind of had the toolkit for, or whether it's something new that you're facing. I'm going to pause for a second because I just heard myself blather on for like a good 5 minutes there and say, hey, did I answer your question, Indu, or?
Yeah. So a couple of things came up in that, what you just said. I want you to maybe teach us, if you don't mind, maybe a breathing technique that you might teach one of your patients. I think that would be helpful.
Cool.
Before we go there, I think some of us have gotten in the loop of sometimes people reaching out to us and sending videos and sending more stuff that increases our anxiety. And sometimes it's meant just to keep us in that loop. And I have group chats and family members and all kinds of stuff. But sometimes it's just, we know that it increases our anxiety. And so is there a way that we can put limits on what we're going to consume from either stuff that people are sending us, or talking to everybody and their mother about all of their stresses, and then it kind of eats away at us, or even the stuff that's on TV? Do you have strategies on some of that?
Yeah, absolutely. You hit the nail on the head by saying learning how to set limits on these things. We're constantly bombarded with information these days, right? If you're a tech savvy person and you're on Twitter, or you're refreshing your browser window all the time, guess what? You're getting new news all the time. Setting limits is something that we can do as individuals in an effort to, I would say, contain ourselves when it comes to how much information are we wanting to and able to take in any given moment. I'm going to approach this from a couple different ways, because I brought up the media part of it. Indu, you brought up talking to family and friends who send things because they're trying to be helpful. There's going to be a lot of possible sources for information. So I'm going to start with media first, because this one can be easier to deal with. Turn off the TV. Pick times that you're going to update yourself, get exposed to news and information, and limit those times. Pick a favorite news program and say, that's the one I'm going to watch each day, and that's it. I'm not going to do a deep dive in the news channels on DirecTV and flick back and forth for 5 hours straight, because that's going to be overwhelming and will be unsettling. Try to put parameters or boundaries on what it is that you're trying to do. Pick trusted sites. Pick validated sites for news as well. We're in a time right now where news is a tweet, which that doesn't necessarily mean it's been researched. It doesn't mean it's been vetted. It doesn't mean it comes from a reliable source. So try to find resources that you think are good. Some of the larger news venues are a good place to start. Or sometimes even if you're going for health specific news during this time with the COVID pandemic, going to sites that you know and trust who are providing updates. There's the generic sites like the CDC site, which is great and has good information, but is also sometimes very just abrupt and kind of limited. I know for us at UCLA, we have a site that gets updated daily with new information that's particular for what's going on in our area. So also being aware of what you have in your own community. Look to healthcare organizations or hospitals and see what they have. So limiting your media exposure, setting times where you catch up on social media, rather than just whenever you pick up your phone or turn on your computer, actually put it on your calendar. Say, hey, I get up every morning around 7 o'clock. I kind of go through my morning routine of, getting up, doing a little light exercise, having breakfast, taking any meds, checking in with the family and the pets or whatever. What I'm going to do is set an hour in the morning that I'm going to get caught up. Actually put it on your calendar. Talk about a great way of setting boundaries. Put it on the big whiteboard calendar on the wall, or in your day planner, or on your phone or your computer, and put a start and an end time. And those things can help us contain our exposure and our own consumption of that information. Going to the second part that you brought up about family and friends, tell people, hey, I really appreciate that you're trying to keep me in the loop on this, but right now I'm feeling a little overwhelmed with what is going on. Sometimes setting that boundary with your loved ones might feel hard because we don't want to offend someone, or we don't want to hurt their feelings because we know that they're trying to do something good. Maybe we know the person and we know that they don't really take that kind of criticism well, but we got to think through all those things and say, how does that balance with how this is making me feel? And if you're feeling that it's kind of upsetting your own balance, try to set that limit. The other thing that you can do, if people are sending you, endless emails, forwarding you articles from all the things that they read, You can also choose to set a time to open those emails. You don't need to do it immediately. You don't need to say, oh my God, I have to read it the second it comes in. You can always say, hey, I'm going to, I set my hour after breakfast to watch the news and to get caught up on Twitter. I'm going to set an hour after lunch to read all the emails that, my neighbor Joe is forward me all day long. You can, again, try to contain your exposure to those things. You can also take more drastic routes. You don't have to answer your phone, right? If someone keeps calling, you can let it go to voicemail. This is a hard one because, again, a lot of times we feel responsible, especially if it's a family member, a loved one, or a close friend. I don't want to leave them hanging if they're calling me, because I'm sure they're doing it for an important reason. But if you are feeling your own stress level starting to do this, that every time you see Joe's phone number show up on your caller ID, you might just say, you know what, I'm going to let these go to voicemail for a while, and then I'll check back in a little while later. These are all limit setting examples, right? Scheduling, setting times both to start and end consumption of media, talking about boundaries, talking to your loved ones and saying, just want to let you know I'm kind of having a hard time absorbing all of this. So, would you mind sending me less? Having those kinds of conversations, which might be difficult. And then sometimes just taking those self-protective measures, which are saying, I'm setting a boundary that the other doesn't necessarily know about. I'm just doing it, right, by not answering my phone for the next 2 hours.
Perfect. Okay. There was a question that came up about what would be good search terms for someone to use for a local or good resource. I mean, I think the CDC for a medical perspective would be right. What I'm still referring to. Is there a mental health resource or something that you might, and we can certainly put it in the sidebar here too, that might be a good resource from your perspective?
If you are looking for mental health updates related to COVID-19, a good resource that I go to is the American Psychological Association, APA. You would think that I could pull, I'm not sure if it's apa.org, because that might also be the American Psychiatric. But I would say American Psychological Association has been putting out a lot of information, including some free access to articles right now.
It's on the sidebar. We're
yeah,
good.
There it is. It is apa.org. I'll take that as a small win for today. They've been releasing information that is COVID-19 specific. So there's access to journal articles that are specifically for this. Another source that can be good, and this is, I'm going to shift just a little bit. Like I said before about talking to a mental health professional, if you're in an area and you don't know who providers are there, you don't know who counselors are, there's a website called Psychology Today that has a tool called the Therapist Finder, which is really great. And it's something that I use all the time, because you can go in and search by zip code, you can search by city, for people who are counselors, and then you can fine tune that search too. You can limit it by who accepts my insurance and who addresses specific issues like anxiety or family issues or chronic health issues, right? For people who are living with things like Parkinson's, that can be a great resource too. That website's up there right now. It's a great way to find things and to search specifically for things you're looking for. I haven't gone on it recently, and I will actually be using it later this afternoon for a patient that I've been working with. But I think it's important now too, given what we're dealing with, is to find therapists who are doing telehealth right now, doing therapy through mediums like Zoom or FaceTime, because we are, of course, encouraging people not to get in close contact with each other, which is kind of what you do when you walk into a therapist's office. It's you and someone sitting across from each other. So you would also just want to make sure at this time, hey, are you offering telehealth? It's something that is being done more regularly because, and I've seen this particularly just because of the patient population I work with, most people are on Medicare. Up until this, Medicare did not cover telehealth for psychological services, but they are covering it during this time. So I think you're going to see more people offering that resource. These are just good questions to ask if you're looking for that kind of tool right now, and using something like Psychology Today to find someone. once you get the names and once you get some people that you think might be good for you, then you want to call them and ask them those questions. Hey, do you accept my insurance? Are you doing telehealth, et cetera? So those were two resource sites, one for good information about psychology and psychological impact in living with current situational factors with COVID-19. And then one was a resource for finding mental health services if that's something you're interested in.
Great. Do you want to try to teach us the breathing exercise? Would that be cool?
I'm more than happy to do it. And it's something that I think, I'll be honest, I've been leaning into a lot more myself, just because, I don't know about you, but just going to the market to get toilet paper is stressful, because A, is there going to be any toilet paper when I get there? And are people going to be crazy and like getting up in my face? And you know, there's a lot of things that just kind of make your heart start to race when you're driving up to Target or the grocery store. So things that we can all benefit from. There's a lot of different options when it comes to breathing exercises, meditation, mindfulness techniques. And I know you've talked about some already, Indu, because you've had some great presenters already on this series. But I like to really look at it as its most basic. I'm going to talk about kind of the simple take a breath exercise, and then I'll talk about breathing relaxation exercise that I like, that does have a meditative quality, but isn't necessarily like some other meditations you've done before, because it really is just going to have you counting. So the first technique I like to call seriously is take a breath. If you catch yourself starting to feel stressed, and you know, there's a lot of physiological manifestations of stress. So I'm going to try to illustrate that. If you feel like your ears are starting to turn into earrings, you're probably going to need to take a breath. If you feel like your heart is starting to race, it's going to help to take a breath. If you feel like your breath is getting shorter, it's going to be helpful to take a slower breath. If you're noticing that you are less patient or getting really worried about something, if you're identifying any of the things happening, I tell people this all the time: stop what you're doing, exhale, and then take a big breath. And then let it out. Sometimes it's just that simple taking a breath that helps you take your stress level from here to here. It's not changing everything, but man, if you're even knocking your stress level down by a couple of degrees, it's going to allow you to function better. This is kind of a good emergency technique. This is the when you're standing in line at Target and you hear someone getting too close to you with their cart, before you turn around and, you know, lose your top and holler at them. It allows you to collect yourself, even just that little moment. It allows your kind of mental energy to go from here to here, which might allow you to engage in a better practice. Sometimes just stopping and taking a breath, or look, if one breath doesn't work, take 3 or 4. You've got the time to do it. A more dedicated relaxation training technique is also a very, what I think is a simple technique. It's called diaphragmatic breathing. It's something I'm sure you've heard discussed before, but it's really about breathing, not so much from your chest, but from your belly. I know you can't see let's see if I can show you my belly. You put one hand on your belly, you put one hand on your chest. When you take a breath in, you want to feel this hand move, right? The hand that's on your belly, you want to feel that move out. And then when you exhale, you want to feel it move in. If you're feeling the hand up here on your chest moving, that's usually when we're in that shorter breath, that kind of anxious breathing. We want to be able to shift it down here to our belly. So when you breathe in, you want to feel that hand move out. When you exhale, you want to feel that hand move in. Now, if you say, hey, I'm trying to do it and I'm not feeling this hand move at all, you can help it a little bit. Whenever you exhale, just kind of push gently on your belly. The next time you take an inhale, guess what? Your hand's going to move out. So what you're doing is you're starting to shift your focus of breath down here to your diaphragm. This is the big muscle that kind of runs across your midsection underneath your lungs. And when you breathe from the diaphragm, you're actually taking in a fuller breath than you do when we're just breathing from the chest. So once you've kind of got a hang of where that breath is going, here's the breathing technique. When you inhale, you count 1. When you exhale, you think the word relax. When you inhale next, 2, when you exhale, think the word relax. You're going to count inhale 3, inhale 4, all the way up to inhale 10. And then when you exhale and think the word relax, your next breath is going to go right back to 1. You're only going to count up to 10 because this is what's going to keep you engaged in the moment, right? This is that mindful component of this type of breathing exercise. It forces you to pay attention to what's going on, and what you're paying attention to really, truly is your breath. It makes it harder for you to pay attention to the thoughts that are going through your head. You're still going to do it, especially if you're anxious or stressed. But when you give your brain something to focus on, right? Am I breathing into my belly? Was that 2 or 3? You know, these kinds of things give your brain something that's tangible in the moment to deal with. These are the kinds of things that can be really helpful. I think someone just commented, it can put you to sleep, right? Either I'm putting you to sleep or the breathing exercise is going to put you to sleep. The breathing exercise is great to use at night, but don't practice it then, because if you fall asleep in the middle of practicing something, you really don't get the full benefit. This is something that you can do anywhere, anytime. So it's something that I like because it does have a physiological effect. As you slow your breathing down, as you count those breaths, you're going to start to feel things like your shoulders drop. You're going to feel your heart rate eventually slow down. You're going to feel that your breathing gets fuller, and you're going to get a little bit more benefit out of it. But that does take some time and practice. That's why the short, just take a breath exercise is a little bit easier. But if you are someone who's finding that you've got a little extra time during this physical distancing and self-isolation, you can practice a breathing technique. Do it for 2 minutes. Do it for 3 minutes. Work your way up to 5 to 10 minutes. You'll get more bang for your buck the longer you practice it. But this one's just super easy because it involves counting and thinking the word relax. I think it's a good one to have in your pocket and a good thing to practice.
That's awesome. So important to stress with that you want to be relatively slow with the in breath and the out breath. You can, if you go too fast, you can actually hyperventilate. Right. So I think all of these breathing techniques, we want to be quite slow and deliberate. And then even with the exhalation, slow and deliberate, so that you're not, and if you're teaching your friends and family, again, you know, people who are anxious tend to breathe fast, and then they can kind of magnify the anxiety by hyperventilating. But these are beautiful, simple practices, and the breath is so important for relaxation. And actually you can get into a relaxation response just with breathing, and the autonomic nervous system. So that's that nervous system that's in the background that can contribute, that's part of that fight and flight response, can really be modified actually very beautifully by breath work. That's very simple and accessible to everyone. So I think if you enjoy these breathing techniques, we can try to put more about this and perhaps have somebody teach this a little bit more intensively, and probably a lot of other resources out there that that we would be able to point people to, because I think this is one of, I think, the most powerful and easily accessible strategies for being able to calm down anxiety. And I use it all the time, and we'll always have our breath, even if we have no yoga mat or no, you know, trees to gaze at. No matter where you are, you'll always have your breath to fall back on. So I think it's a really beautiful thing. So maybe we could try something later if we have time, another exercise, if you might think of one. But Arik, I wanted to ask you, we were joking around a little bit, or not really joking, but just talking about the types of folks that are out there in our own lives and some of our patients. And there's been a few people that I've been friends with and colleagues and stuff, that many of us are really heightened and anxious and are having a really hard time with social distancing. But there are people out there that seem to actually be pretty well and actually be taking this as if it's maybe, you know, not such a big deal. Not they are following the social distancing, but they just are, it's not impacting them so badly. Perhaps we can speak a little bit about that, because I think if you're friends or family of one of these people and you're feeling a certain way and you're trying to talk to them and they're not really feeling the same way, it might sort of put a wedge in your ability to connect with them. And I think that from a psychology perspective, there's an explanation, at least in certain people, as to why, you know, we've talked about this maybe the case.
Yeah, I think I'm gonna start this just by saying something that I haven't said before, but it's something that I think is a given whenever we talk about how people cope with things. Everyone copes with things differently. And it is during times like this where we see something that's impacting pretty much everyone, and most every single person is aware that this is going on, right? We see different levels of reaction to it. Some of us do get stressed and anxious about it, but we see some people who are responding almost in a paradoxical way where they're just like, hey, this is easy for me, right? Like, hey, I'm actually doing pretty good. And Indu and I were talking about that earlier, actually noting that some people that maybe tended to run on the anxious side or to be a little bit, kind of lay terminology, a little bit higher strung, or maybe that person who you would say in the family is the hypochondriac, and, you know, people that tended to be a little bit more intensely focused on things prior to this occurring may not be responding in the same way. And in one way, they might be feeling kind of like, oh, now everyone's in the same boat that I've been in before. And as everyone is reporting, and everyone in quotes, right? As more people are reporting this increase in stress and anxiety, the person who is already stressed and anxious is realizing that they're actually almost more normal at this point. So it's kind of an interesting phenomena to see. We also note, and I'll say this just from my clinical experience in the last several weeks of conducting telemedicine visits and actually getting welcomed into my patient's home instead of me welcoming him to my really boring and ugly office at UCLA. I see people who are saying, yeah, I'm doing fine, right? I didn't go out that much before anyways. I, would go to PT or to my exercise class or would run errands. And while I miss those, this might not be that big of change for me. So for some folks, they're saying this is actually kind of normal. And I'm throwing the kind of in there on purpose because it's not normal, but this isn't that far from what their usual routines are. We see some people actually getting benefit from it. My spouse is home more often, so we're seeing more of each other, or I'm seeing the kids more often, or, I'm not having to deal with running around and doing however many errands per day, and I may be benefiting from that. So we are seeing some people actually saying, hey, I'm getting something maybe positive from this experience. It is different for everybody, right? But there are some cases that we have seen that may be a little bit of a surprise to us. And that's where I come back to that basic statement. Everyone handles it differently. We got to recognize that. If you have someone in your life, a friend or a family member who, if you're feeling all stressed out and you call them up and they're like, hey, I'm totally cool with this. Just remember, hey, they're a different person than me. They're coping with it themselves. And if you want to take it a step further and you're curious, you might just say, hey, I'm noticing this about the way you responded to that. Can you tell me a little bit more? That's if you want to be an armchair psychologist, right? You got nothing else to do. You're going to train and become a psychologist during this time. That's a good way to do it. Hey, I'm curious about what you just said. Can you tell me a little bit more about where you're coming from with that?
I think it's just important to just, be open and accepting of wherever people may be in this, and to try to support them where they are and not try to magnify their fears or, I think we're all just trying to figure out how to cope. And I think coping, like you said, is very individual. So, but there is this population of people that are actually feeling, I think, like you said, because many other people are feeling more depression or more anxiety or more, stress, that they're finally feeling like, hey, I have a tribe now of people around me that are feeling like I do every day. And so, this is kind of making them feel a little bit more accepted or something like that. So I don't know. We'll have to see how it all pans out, but it's just something that I noticed. On that note, you were talking, I think you were getting to this, and I've been trying to ask our speakers a little bit just to put a positive spin a little bit on things as well. And everyone's come up with various interesting answers. So I think it's been a good question. My sense is that there are some silver linings in the terror and all the stress that's going on. I'm seeing some silver linings, and I wanted you to have a chance to speak about those specifically, maybe that you've seen.
I think it is important whenever we are dealing with something that changes our way of life, right? I'm gonna step back a second, because again, thinking about who we're talking to right now, this is a group of people that are living with things like Parkinson's and other movement disorders. There was a point in time where you were meeting with a doctor who said, I'm going to give you this information. You have Parkinson's disease. You have blank diagnosis. And that was something that probably changed your life in that moment and changed your life moving forward. And in talking to folks, even before this current situation, a lot of times we would talk about how you have an opportunity, if you will, to find something positive within an overall negative situation. People who are living with Parkinson's disease have been able to say, through this, I have learned this about myself, or I've had this opportunity to connect with people in a different way, or I've tapped into a skill set that maybe I didn't realize I had before, hadn't been using before because of what is going on in my life right now. So people are sometimes able to find something positive from it. How can you apply that same approach in this current situation? I think it doesn't hurt to actively try to do it, right? To actually sit down and say, what am I getting out of this, right? Aside from feeling stressed out, aside from getting overwhelmed by everything I'm watching on the news, aside from not being able to do the things that I used to do, what have I been able to do that I would count as positive? And again, this is something that's going to differ from person to person. I've heard people say, I organized my spice rack. I hadn't done that in years. I think that's a good thing. I've been amazed at the kinds of things I've been able to cook the last couple of weeks. I love to go out to eat. And since that's not an option right now, it's been really interesting to say, okay, I got to try something different than the kind of, handful of recipes that I would do before. People are tapping into things like some of the more mindful practices, doing more yoga at home. You can do yoga whether you're someone who's good at it and has a mat and all the equipment, or you're someone who's sitting in a chair doing a 5-minute chair yoga class. People can try new exercises and new experiences and maybe walk away from it going, oh, that 5-minute breathing exercise that I tried today, I actually felt a little bit better when I was done. If you actively look for something positive, it increases the likelihood of you finding it. Now, if you're stressed, anxious, depressed, it's harder to do so. And that's where I'll tell people that, maybe that positive thing that you're looking for is going to be really small and something that you might have discounted before. I find it really positive that I'm in a full outfit right now. Like I've even got, they're chinos. They're not dress pants on right now, but I'm not in sweats today. And to me, that's a big win. I'm really pleased with myself, and I'm probably going to keep it on for the rest of the afternoon. Sometimes it's finding those kinds of things that you would normally dismiss, right? You would say, oh, we don't usually leave the house anyway, so staying home isn't that big a deal. But you might be able to twist that a little bit more positively by saying, even though we're not doing anything different than what we normally would, we're doing so with this increased awareness of social distancing or physical distancing and obeying the recommendations and adhering to recommendations that are being given. There's a way that you can find something that skews positive. Sometimes you just might have to look a bit harder to do it.
Yeah.
Trying is the best way to start doing it, and just taking those attempts and maybe giving yourself credit for something that would normally be small.
Yeah. And even I think, I think, with the lack of being able to go to your hairdresser or to your, nail salon or whatever you might be used to, or whatever you've done before, I think many of us have let things slide into an interesting sort of look. And, I've been using this as like, maybe I'll put some lipstick on or something, to try to break up the, sort of mundaneness of the day. And I think that, kind of trying to schedule still sort of a taking a shower and changing into an outfit, and taking care of yourself and giving yourself a little bit of self-care, even if it's doing something as small as brushing your hair and putting it up and putting some lipstick on, or changing into chinos or whatever. I think these small things bring that normalcy of regular life back into the sweatpant sort of hat or whatever, and now we have a mask in LA that we're wearing outside. It's a really fascinating look that we've all trended towards. But I think there's this, small things. People are writing comments such as, I baked banana bread with overripe banana that I would have usually thrown away. I mean, I think, yes, the food, these small things about sharing these experiences, having a sit down, maybe dinner with setting the table with a few wine glasses and making it a special event because you can, and take the time to do that, and give yourself a little date night, or family dinner, a Sunday family dinner, and make a little extra banana bread. Or my children are making various cinnamon buns and brownies and all kinds of things. People are writing things like video chatting with friends. Yes, we're having virtual happy hours with or a tea break or a coffee break or something with a friend or two. We've been using WhatsApp or FaceTime, things like that. So I saw a patient through video chat who has been going through his contacts list or video visit. And he's really been using the time to reconnect with old friends and going through a contact list or the Christmas card list that you normally would just, hey, I'm alive, send a Christmas card, have a nice year or whatever. But, calling one of those people a day or whatever, and actually catching up, with a person that you wouldn't have actually had the time to do that with, and who may, have something really remarkable to add to your day or your life. And I've had a few of those. People have reached out to me for whatever reason. I thought of you today, and these are, my old trainees from residency that, it's really beautiful, really, really beautiful that people are having the time to think about each other. People are writing family game night via Zoom. A couple of other comments. Somebody said, the situation has been an opportunity to normalize anxiousness and build empathy, which I think is absolutely correct. We can all identify with our own, patients and things around this time more. Somebody else wrote, we are homebodies anyway and usually would be fine, except for the fact that now suddenly I find myself wanting to go out, probably just because we can't. And I think, yes, I think we've seen that too. And then somebody else wrote, my dog is a bit confused that I'm always home. Yeah, I think a lot of our pets, I think Dr. Julia had said that too, is that she adopted a cat like 6 months or a year ago, and was noticing the cat and was just so appreciative of this cat in her space, and where normally she would just come home and drop her stuff and like run around, and it was like this kind of a accoutrement in her house. And now it's become something that she's really, taking the time to enjoy, and knows the sleep cycle and awake cycles of all of these things. So yeah, these comments are really resonating. I think we're all together feeling this. So I wanted to pivot a little bit, Arik. You have been a remarkable resource for me around one or two things that you've been passionate about that we've shared. And we will be talking a little bit more about this in the future here. And so I know that one of the things that you have been talking a little bit about is the uncertainty of the future. And so I don't know, have patients been talking to you a little bit about if they got sick, any sort of fears about that kind of stuff? And in your sort of, sessions?
Yeah, honestly, this is not something that's been coming up a lot, because the people I've been talking to have all pretty quickly adhered to the recommendations to stay home and to physically distance. But it is something that's coming up in kind of the bigger circles within the psychological profession, and even just in talking to your healthcare providers. people are worried, what happens to me if I get it, right? What if I catch the virus? And I think it is something that, it's hard right now because we're still learning a lot about how this virus works. And we do know that there are people that are at higher risk just because of some factors, including age, underlying health conditions, immunodeficiencies, things like that, that put people at a little bit higher risk. We've talked about this a bit, where some of the neurological condition diagnoses, Parkinson's disease, Huntington's disease, which I work with, don't immediately put someone into a higher risk category. But if someone has issues associated with that diagnosis, like swallowing issues, that could increase someone's risk should they get this virus, which affects respiration. And if they're not able to swallow or clear secretions, it could potentially lead to greater risk factors. But talking about the unknown is something that does come up a lot in my conversations anyways, because again, a lot of people I am working with are newly diagnosed with a health condition that, the second someone is diagnosed with Parkinson's disease, I'll ask them, what did you picture your future? And it's a very common response that someone says, oh, I'm afraid I was going to be that old man or that old lady in a nursing home in a wheelchair that someone just wheeled into a corner and then left there by themselves. And I say it because it's kind of a funny image in a sad way, but it's funny to me how many people think something similar to that. There is a tendency when we are dealing with something that is new, that is scary, that's unknown, to project into a future and to project into a pretty bleak and dark future. So when that occurs, and not just in the context of talking about COVID-19, but also in just general diagnoses of things like Parkinson's and other neurological conditions, while that is one possible outcome, right? That negative image that someone is projecting into the future and seeing, that's one possible outcome, but it is just one. So a lot of times I'll encourage people to say, what's another one? And now that you've come up with a second, what's a third one? And the more that we're able to see there's multiple possible futures that we can hypothesize based on the information we have right now in this moment, that kind of lessens that overall anxiety and stress. I'm going to segue from that into this idea of control, because a lot of times, the fear of that future involves things like what we're talking about now. What if I do catch this virus? What if I do get sick with it? What if I do end up in the hospital at this time, which, it's not like going to the hospital before. I would be in there by myself. I might not have my family or friends able to even see me. People are going to have more specific worries. And while we can't necessarily plan for every possible outcome, there are things that we can do to talk about preparing for what is ultimately an inevitable future for all of us, which is death, right? And I heard myself say that out loud. I'm like, whoa, you just got really morbid really quick, but we're all going to die. I hate to break it to, everyone who's attending right now. It's going to happen at some point. But when we're in a situation like this, where it might make us think about it a little bit more, or when we're even just dealing with a diagnosis of Parkinson's disease or an atypical Parkinsonian disorder or some other neurological condition, it may make us think about death in a different way. We're not going to be able to control necessarily how or when that occurs, but we can put some things in place that might give us a little bit greater peace of mind, if you will. This may be something, I think, Indu, you mentioned that you're going to have someone on to talk about this.
So we're going to have this Friday, we're going to have Mina Makajani, who is a colleague of mine from the geriatrics community, who's very interested in talking about advanced care planning. So we're going to talk a little bit about that then. And then we'll have another colleague, Farah Daly, who's actually works in a hospice in a few weeks. So I think we're trying to offer these, and we wanted to just introduce it to the gang here a little bit from your perspective. And I think that what I want you to talk maybe a few minutes about, because you have this rich experience, especially in the ALS population. So Arik, Dr. Johnson, works around the Death with Dignity Act, and is the psychology advisor, kind of, or what, can you explain what your role is and maybe just speak to it a little bit as it pertains to Parkinson's? Not to get super morbid, but I think these are things, because you're on here, and I wanted to have you on here anyway, one of these days, maybe we could just spend 5 minutes just talking about this, just so people have a bit of a sense of, you know, what you think from the Parkinson's community, you know, situation, and also because you work with this around cancer patients and other diagnoses with a very, you know, sort of different prognosis.
Cool. I will do that. I'm going to go right back to advanced directives for a second, though, because I'm so glad you guys are going to be talking about it. It's something we should all be talking about. Not necessarily every single day, but man, it's a good conversation to have with family, with friends, with yourself, just so that you have an idea of what you want and what you don't want. When we get to that point, someone made this comment, if you live long enough, something will get you. Something is going to get each and every one of us at some point. But we can put some things in place that might make our experience of that better. So I think, you know, if you've got some extra time right now, there's some great resources online. UCLA's got a really nice advanced directive template that you can get online. I really like it because it's useful in having the conversation. It kind of helps you think about things a little bit more than, you know, oh, I just don't want any heroic measures. Well, what does that mean, right? This helps you dig into it a little bit more. So it's a great resource. Glad you guys will talk about it more. Happy you're going to do that. Let's talk about death with dignity, or the, as we call it, it's the End of Life Option Act in the state of California. There is a law that permits people to request a medication that will hasten their death. So it's a medication that's going to aid in dying if you meet certain criteria. Basic criteria are, and there's several other states in the US that have this as well, but in California, you have to be a resident of California of 18 years of age, who has been diagnosed with a condition that is terminal, and you have an expected 6 months or less to live. So those are the really basic criteria of the law for people to even pursue it. You also have to have the capacity to be able to make this request, meaning you have to not have something that can affect the way that you think, or any sort of psychiatric condition that might be leading you to feel suicidal. So this is something that is really, really fundamentally in the law to try to limit who can access it. As Indu mentioned, this is something that we see most frequently in oncology. Approximately 85 to 90% of all people who have pursued the act have cancer. Of the other 10 to 15%, it is primarily neurology. And within neurology, it's people who have ALS, and then people who have cardiac and other pulmonary type of conditions. The California End of Life Option Act and the other End of Life Option Acts across the country really don't cater to people who are living with something like Parkinson's disease or some of the other affiliated movement disorder conditions like the atypicals, Huntington's disease, dystonias, etc. These are things that don't have precise measures to them, right? With ALS, a person can do a breathing study and the doctor can say, based on, you know, what your breathing capacity is right now, I can tell you that you've got 6 months or less to live. But people with Parkinson's don't really have those kinds of specific measures, right? We know that people are going to have an impact on their function the longer they live with Parkinson's disease, but we don't know how much that is actually contributing towards their demise, as is the overlap of the fact that they've also lived another day. So the bottom line is, right now, it is very hard for people with things like Parkinson's or other movement disorder conditions to qualify for the types of acts. The other thing that impacts a person's ability to do so includes sometimes mild cognitive impairment that can be associated with Parkinson's, or dementia associated with Parkinson's disease, or some of the other conditions as well. And lastly, I think this one is almost just on the more practical side. people have to be able to consume the medication themselves. And sometimes people who have swallow issues aren't able to consume the quantity of medication in the time needed to get the expected result of it. All of this to be said that, yes, while it's difficult for people who are living with Parkinson's and other movement disorder conditions to pursue this, it's something worth having that conversation with your doctors, with your legislators, because this is something that, you know, we know when you are diagnosed with something like Parkinson's, it affects everyone differently, right? Some people live out the rest of their life with Parkinson's, right? It impairs their function. It might make things harder for them to make it harder to do things that you used to do, might have an impact on your relationships and your roles. And other people are impacted much more severely. It is something that we may see more conversations about over time. And there are groups that talk about things like this. I just had a total brain fart on I think it's Compassionate Choices California.
Yep.
Is an advocacy
like
group.
Yeah, 4Cs. Yeah.
Yeah.
Yeah. Well, that's really great.
I think I only came up with 3. So
that's a good teaser on, you know, at least that, because that's a question that a lot of patients ask me just in general, because they're interested in knowing. But, you know, it's good to have somebody who's involved in the actual decisions that people are making and in sort of these conversations because very few of us as Parkinson's docs have ever even really thought about it, let alone been involved. So that's really helpful.
To that point, it is a conversation when it does come up that we'll bring it back to, let's talk about advanced directives. Because while we might not be able to pursue this thing, we can absolutely talk about what other things a person can do. And that's where, you know, again, coming back to talking about advanced directives and what you want at your end of your life is really important.
Okay, and we can put up some of the resources. I don't think it's Compassion and Choice. We got to look it up. I think the UCLA Health one is correct. Some of the other ones are correct. We'll get back to you on a couple at the end of this conversation. Eric and I will try to find a few resources. So, are there any questions from the audience? I see a lot of comments, but any questions for Eric about what we might have talked about here? I think we've kind of hopped all over a little bit, but I don't know if there's any specific questions that people have. If there aren't any questions, is there another short, we have like 3 or 4 minutes. I don't know if there's a minute or 2 other exercise that you have talked to people about doing. And maybe
I played my 2 cards already.
Okay. I know that we've talked, I think journaling and gratitude practices are also very helpful. So maybe you want to talk about those a little bit.
Journaling practices, I think, can be great. If you are dealing with stress, anxiety, worries, it is good to have some sort of outlet. And sometimes a journaling or writing exercise is a great way to do it, because you don't necessarily need to connect with someone else to do that. You can do this on your own. Sometimes it's just the cathartic release of what's in your head, whether it's in conversation or onto a piece of paper, that can help a person feel better. You're also able to sometimes use those things that you write down to come back and revisit at a later time. And you can start to pull from that, oh, these are things that I actually need to pay attention to, or this is something I need to work on right now, because that's going to help me. I'm going to pivot from that a little bit and go back to something that you brought up once, just about scheduling time to do those things with friends or family, or I brought it up too with, you know, setting limits on TV and things like that. The idea of scheduling and setting a routine right now, especially during times where things are totally different, is a great tool. Setting boundaries for yourself, maintaining a calendar, maintaining a daily schedule is a great way to help manage stress and anxiety. If you have, you know, I'm all about my phone, and I've got my calendar on it. It's color coded and a little bit maybe obsessive sometimes, but it's something that I can refer back to, and it helps ground me at, you know, this is where I'm at in the day, and this is what I've got left in front of me. And a lot of times we think about using tools like our calendar for things like scheduling our appointments or different events that we're going to go to. But it's also great to put in things like eat breakfast at 8 o'clock, walk dog at 8:30, exercise from 9 to 10, put on pants instead of sweatpants at 10 o'clock. You know, the more things that we put on there, it gives us something to refer back to. It gives us something to look at in a concrete form that our brain can say, hey, I now see what my entire day looks like. Even if we're not consciously aware of it, when you see something like that, when you see a structure like that and you see those things contained, it allows your brain to stop worrying about how am I going to get all this stuff done to see, oh, I've already broken it down into these small, manageable, bite-sized units. It's a great, great resource. Whether you do it on your phone, whether you do it on a big whiteboard on the wall, whether you do it on a desktop calendar, or just a piece of paper, writing things down, having it in an objective, structured format can really help. It's not another breathing exercise or relaxation exercise, but oh my God, use a calendar, use a schedule, do something like that because it's a great containing.
No, I think that's perfect. So we have like a minute or two left. I wanted to just say my last little thing. I think that the scheduling idea is good because it is some way also to take some control, right? Mm-hmm. We want to find small pieces of things that we have control over. So I have control over, you know, what I'm wearing and, you know, what I choose to do with these. Sometimes I do my hours of my day, and writing it out and having a sense of that as of self, sort of the, you know, ability to affect control is I think helpful for us to hang some hats on things so that, you know, we have a way to structure our thought process around these things. So I think that's great. Thank you so much, Arik. You've been amazing to have on, and thank you for talking about some harder topics to really kind of dig deep into. I think these are things that nobody really wants to happily necessarily chat about in this sort of forum, but I think people are wanting to hear this. At least the patients that I've been talking to have been hungry to hear a little bit about our sense of, you know, some of these, you know, advanced care planning and things like that. Maybe I'll just give you a last, you know, 30 seconds to close, and then we'll hand it over to the gang at PMD Alliance. Thanks again for hosting, and thanks for joining us.
Yeah, and I'll just say that too. Thank you so much for having me, and thank you guys for listening to that broad array of topics today. The more we talk about them, the less scary they become. So I'm so glad to have groups like the PMD Alliance doing things like this. And Dr. Subramanian, thank you so much for inviting me on, and you guys for having me. Really appreciate it, you guys. Keep it up.
Thank you. We'll hand it over to you guys.
Thank you.
Thank you.
Thank you, Dr. Johnson, too. I mean, we can't do these without experts and doctors like you being willing to bring this information to our audience and hopefully to those who are finding us on YouTube, etc. We are recording today. It will be up. It usually takes a couple of days to get this up onto our YouTube page. It will be available. We have, if you go to our website, pmdalliance.org, if you click on programs or NeuroLife Online, there is a link that is at a glance, and we are updating with YouTube videos of past programs and future programs. And we do have one coming up on Friday that Dr. Subramanian and Dr. Johnson kind of gave you a little teaser on that we're very excited for. And for those of you that I do know had maybe a little trouble registering this morning, our developers are working on that. So we will be sending out an email for you to register. Hopefully that will be fixed in the next day or so. So just so you don't have any extra added stress, as we talked about today, I would refrain from registering today, but hopefully by tomorrow or Wednesday, it'll be back and working. But you can always reach out to us if you want to register ahead of time. You can email us at info@pmdalliance.org, and we're happy to help. So thank you, Dr. Johnson, Dr. Subramanian, and thank you all for joining us. As we end, for all of you who have your cameras on, just give everybody a big wave goodbye. It was so great to connect with you all today, and we will see you next time.
Hey,
Bye.
Andrea, can I make a quick comment?
Sure, go ahead, Dave.